So what we're going to do in this one right now is we're going to do some cross-fiber frictioning around the patella. This would be for a hypomobile patella. See if we can get a little bit more mobility in the patella. You need to be careful that you're not working with somebody that has had a patella dislocation, or you have somebody that has a hypermobile patella, because you can actually cause some problems that way. So we're working with a hypomobile patella with less than normal movement. So I'm going to actually move the patella superiorly, and I'm going to friction around the patella, trying to see if I can get underneath the edge of the patella. And we're not going to friction for very long, maybe 20 to 30 seconds in each area. And right now we're just working along the top edge of the patella. I like to do one finger on top of the other one. You can use a thumb if you like. Just trying to increase a little bit of mobility. And the tendon up here, quadricep tendon. I'm going to move to the medial side, so I'm actually going to push the patella medially, and I'm going to friction underneath the medial edge of the patella. Okay. Worked around that medial side of the patella. Now what I'm going to do is going to push the patella inferiorly, and I'm going to work around the bottom half of the patella and over the patellar tendon. You may have someone that when you push the patella down inferiorly, they may experience some pain on the underside of the patella, possibly due to some roughening of the cartilage on the underside of the patella. If you have that, it might be best not to push the patella inferiorly. You can also do this without pushing the patella down. I like to move the patella down so I can try to get a little bit underneath that edge of the patella. Again, we're trying to get some more movement out of the patella. We're trying to mobilize it a little bit more. Possibly this is causing, or maybe one of the things causing their knee pain. Again, most of the time the knee pain is coming from a specific condition. They could have some tendinitis, tendinopathy conditions. Most of the things fall under the umbrella of patellofemoral pain syndrome, PFPS. They could have pain due to excess pronation in their feet. Have pain due to a larger than normal Q angle. Many number of reasons for pain around the patella. Now I'm working the lateral side of the patella, pushing the patella laterally. And then just working around that edge. Okay, come on this side. Again, maybe 20 seconds, 30 seconds at the most on each area. Okay, and then what I'm going to do is just mobilize the patella into different movements. Right now I'm pushing it down inferiorly. I'm going to just hold this position. Maybe a minute or so. I'm not going to show you the full minute. Then I'm going to move it medially and hold it for about a minute. I'm not going to hold it for an entire minute. And then I'm going to push it superiorly. Now I'm going to pull the patella this way, laterally. And hold it for about a minute or so. And you can just see if any of the, you have a little bit more mobility than you had before. And if there was any pain or discomfort previously, see if that has diminished at all. Okay, that's our video for today. Thanks for watching, and we'll try to come up with something really good for you next time.